Welcome back, everyone, to TV5 News. At 9, it is Nurse Practitioner Week, and we are honoring all the hard work that they do to keep us healthy and safe. So joining us this morning to tell us more about the profession, we have President of the American Association of Nurse Practitioners, or AANP, April Kapu. Thank you so much for being here. How are you this morning?
Thank you. Thank you for having me today.
Yes, absolutely. We love having you. So to start us off, April, what is the purpose of Nurse Practitioner Week?
National Nurse Practitioner Week, it's November 13 through 19. We are celebrating the many valuable contributions nurse practitioners bring to patients everywhere across the country. I don't know if you know, but we're up to over 355,000 NPs across the U.S. working in every community.
And we're glad that they're in our community for sure. So just run us through what differences there are between a nurse practitioner, maybe a registered nurse or a licensed vocational nurse.
So a nurse practitioner is a registered nurse who has pursued advanced education and clinical training and then ultimately nationally board certified in a particular field of practice. So we're educated and trained to diagnose, to treat, to order and interpret tests. We prescribe medications, we coordinate care, we collaborate with all of the healthcare team. And again, like I said, we're practicing in all settings today.
Yeah, it's wearing many hats, it seems like, in the field. That is great. Can you say how the role and maybe responsibilities of nurse practitioners expanded, especially during the pandemic?
Oh, yeah. So the pandemic, we have been stepping up over and over again, as have all healthcare workers. When the pandemic hit, we were all certainly taking care of patients in our clinics or our hospitals or home care, whatever we were doing, but we also stepped up to make sure that there was access to care in every community. So that's why you saw us in community centers, in churches, putting up drive-through testing sites. We were expanding EDs, urgent cares. We were building on ICUs. We were seeing patients in the home via telehealth and so much more, nursing homes, to just make sure that everyone had access to testing, to treatment, and then to vaccinations, making sure everyone has access to vaccinations so that they can prevent getting COVID-19 or certainly lessen the severity. So we've been out there since the very beginning and continuing to provide care across all settings. And certainly this fall, we not only see COVID-19, but also RSV and flu, and we're there.
Yes, and we appreciate it all the way. Yeah, we know RSV is certainly spiking, at least here too, locally. So we also are hearing reports of nursing shortages all across the country. What do you think can be done to help draw new people into this profession?
Well, we need more nurses. We need more nurses of all types, but certainly nurse practitioners. So we would encourage everyone that's looking into nursing or nurses out there thinking about an NP to go to wechoosenps.org, and they can find out more about what an NP does and the different programs that are out there, the different types of NPs, but also I would say ask an NP, shadow with an NP, ask questions, because it's a very rewarding career. It's one of the best decisions I ever made.
Nothing better than getting that hands-on experience. That's great. We want to learn a little bit about yourself, April, and why you chose this profession and what keeps you going.
Well, my background is as a critical care nurse. And as a critical care nurse working in a cardiovascular ICU, I had the benefit of working with great nurse practitioners. And I said, that's what I want to do. So I pursued my master's and then ultimately my doctorate to be a nurse practitioner in critical care. And now today I have the wonderful opportunity to be president of the American Association of Nurse Practitioners, the largest NP organization in the world that represents all specialties of NPs. And our mission is to empower all NPs to be able to provide accessible, equitable, high-quality care to patients everywhere. And so we provide a lot in terms of practice tools, education, advocacy, research, evidence-based practice, scholarships, grants, and leadership. So it's the best job to be able to support so many NPs everywhere.
This has been really great talking to you, April, this morning. Is there anything else you would like to add before we go?
Just happy Nurse Practitioner Week to all of the 355,000 NPs out there.
Absolutely. Thank you again for your time.
Thank you.
Of course. And you can find more information by just going to the hot links section of our website, WNEM.com.